we're always learning through this pandemic, and navigating through the next months is not going to be an easy thing. One of the equations that one needs to understand is that if measures are let go of too quickly and vaccination rates are not going up fast enough, you're going to get into a situation where this virus, the Delta virus, is very contagious. And so you're giving room for this virus to accelerate if your vaccine coverage isn't moving up faster than your reopening or easing measures.
Well, we've heard now from frontline healthcare workers in Alberta about the health state of emergency and dire situation in their hospitals. Here at home, doctors are trying from afar to help Alberta avoid a critical care triage scenario by calling on this province and others to step up.
To discuss what help is needed, what local healthcare workers can do, and if there are lessons we can learn from the situation out west, we welcome to CP24 tonight epidemiologists Raywat, Deonandan, and COLIN Furness. We appreciate both of you making time for CP24 tonight. Raywat, we just heard from some health officials in Alberta, and it's a dire situation. Comparing the numbers they're seeing to Ontario, we would be seeing 5,000 cases a day. What do you make of what's happening there in Alberta?
It's entirely preventable. This is the sad part. This was foreseeable, and this is the result of human action. So where we are now compared to last year is last year we were at the virus's mercy. Now we're at each other's mercy in the sense that we have the tools to prevent this. What we need to do is vaccinate and use other mitigation strategies like mask wearing and vaccine passports, etc. So the key in Alberta is to ratchet up the vaccination rate as quickly as they can, and in the meantime, bolster the healthcare system to deal with the current crisis.
Colin, as an epidemiologist, I wonder how you feel when you hear someone like Premier Jason Kenney say that they're in the situation that they are right now because COVID-19 is unpredictable.
That makes me rather angry, actually. COVID-19 is actually fairly predictable. It's always a question of when and not if. And I know people love to point to Florida and say, look, they've got no restrictions and no COVID. And then, of course, Florida became what Florida is now. Alberta followed the same route. It is poor leadership. And I think beyond simply doing measures that need to be done right now, I think Alberta needs a change of leadership. I think they have lost public trust. They've certainly lost mine.
In the meantime, where do we begin, Colin? I mean, we heard from Dr. Vaisman there saying that they're not even telling families if there's a case of COVID in a classroom.
Well, they can't at this point. And I think, the active cases per population is 10 times what it is in Ontario right now. If we had that here, we would be locked down. We would be stay at home. Everything would be closed. Alberta doesn't even seem to be considering that right now. And I think they've got some very hard weeks ahead.
I want to welcome to the conversation Dr. ALON Vaisman, an infectious diseases specialist with the University Health Network. Doctor, thanks for joining us tonight as well. What's your reaction to what we're seeing not only happen in Alberta in terms of the case count, but now this reversal on restrictions?
Yeah, it's unfortunate that they're seeing such high cases. I think a lot of people were identifying the problems earlier on in the summer, in the beginning of August, when there was a declaration that they're going to move away from a lot of the common sense mandates and restrictions that were in place to prevent COVID transmission. A lot of people recognized at that time that that was going to be a problem. And right now, I think we're seeing the consequences of what was seemed to be a very early pullback from a lot of the restrictions that made a lot of sense. Part of the reason why here in Ontario, we're not living in the same situation that they are in Alberta.
Raywat, we've learned about this virus during every wave, right? We've learned more about COVID-19, and now we're in the fourth wave. Can you identify the missteps in Alberta and at what point they took place?
Well, a primary misstep was in relying upon modeling based on UK data that was mostly based on the Alpha variant, whereas Delta was what's going to cause our crisis right now. So they relied heavily on that modeling, and it was faulty. And as a result, they opened up way too quickly. We know that COVID is insidious. Delta in particular is insidious, hypertransmissible, loves indoor environments, and we need a very high rate of vaccination before we can open things up with some degree of rigor. So opening up too fast and too early ahead of the rate of vaccination was the biggest error to my mind. So what do we do now? Again, we ratchet up vaccination. We incentivize as much as we can, in particular age groups in particular, and also certain geographies. So southern Alberta and northern Alberta have the lowest rates of vaccination, under 50% of the total population. And those over 70 are at under 90% vaccinated, which is really troubling to me. That's the most vulnerable demographic. And of course, as across all of Canada, the young people are slow to vaccinate as well. So Alberta needs to incentivize vaccination across the board. Vaccine passports help, but they're not going to be enough. And so they got to pull in all the plugs at this point.
Colin, there is a form of a vaccine passport that's now being implemented in Alberta, but it's not exactly as strict as what we have, say, here in Ontario and in some other provinces. Do you think that it's going to be effective at all, given it places a lot of onus on businesses, independent businesses?
What we have seen elsewhere in places that one might consider more moderate than Alberta is some pretty angry protests, verging occasionally on violence. The problem in Alberta is the leadership has spent a long time telling the public that everything's fine and they're never going to do this. And I think that's going to make compliance proportionately harder. And I think that is going to fall on the shoulders of businesses. It's gone in very ugly ways in Quebec and Ontario and BC. I think it's going to be worse still in Alberta. And that's going to be on top of what is already obviously a really tragic situation.
Mm-hmm. And Alberta's not an island, right? So what about the rest of the country, Dr. Vaisman? What should we be watching for and how could we help?
Yeah, so unfortunately, that results when you have an overwhelming amount of cases in one province or one region is that the patients who would otherwise seek care for non-COVID related reasons or for COVID related reasons are going to require care in other provinces because the hospitals there are overwhelmed. So similar to what we saw here in Toronto in the peak of wave 3, where patients needed to be moved around in order to be appropriately looked after, that could very well happen, and it's probably starting to already happen right now in Alberta to other provinces. And then what we could learn from a situation is similar to what's been discussed, is that pulling back on restrictions when we're talking about Delta and with vaccination numbers that are not quite high enough is a major problem. In Ontario here, we moved at a much slower pace, so we're still unclear what direction we're going to go in. But I think the main thing to realize is that you have to have a little bit more kind of respect for the Delta variant than the other variants.
Raywat, I wonder about lessons too when it comes to young people and the school system. Dr. Vaisman, who we were talking to in the last segment, had some alarming numbers in terms of cases as they apply to children under the age of 12, of course, kids that cannot be vaccinated, and the rules that currently exist in schools, no masking for kids under or below grade 4. What about lessons that, you know, perhaps will be tragically learned as a result of those decisions? What do you think?
Well, what we know is that the number one way to keep COVID out of schools is to keep it out of the community. It's in the community now, so we got to stop it from transmitting in the community. Once it's in the community, keep it from getting into the schools. We do that through vaccinating all the adults that the kids come into contact with, having a vaccine mandate for all school workers, encouraging vaccination for the parents of school kids, having the masking. They have to reconsider the masking mandate. I think a high-quality mask worn by most people indoors will help enormously, and investing in ventilation schemes. That's been largely ignored to this point. As well, a more immediate application of tools might be flooding the province with rapid tests. If we can take people who are infectious at this given moment out of circulation on a given day, we lower the probability of contributing to any outbreaks. So we haven't used all the tools at our disposal yet, and Alberta really needs to start exploring all the tools they can use.
Okay, and before we let you all go, I wanted to get your thoughts on the new names for these vaccines. I mean, we say new, but they're not new. They're the names of the vaccines. They had yet to be named by these companies, right? Colin, what are your thoughts?
Well, I think actually public messaging around that matters a lot. We know in BC they talked about mRNA vaccines instead of Pfizer versus Moderna, and we didn't see the same brand choosiness. And that's an interesting finding because in Ontario, of course, it's the opposite, that there's a lot of discourse around this versus that. Brand appears to matter. It shouldn't. But it really, really does. And I think if we can do branding, if companies can do branding in a way that makes these vaccines seem safe, seem accessible, seem like a good idea, you know, that's in the domain of marketing and advertising. I'm all for it.
Interesting. Dr. Vaisman?
Yeah, that situation is similar to when we prescribe drugs. There's a generic and a trade name for the medication. So a similar kind of thing exists for vaccines as well, just that we don't commonly use the names as often. Now that we have names, trade names for the vaccines, I think it's a good idea that was mentioned that one way you can actually get people to undergo vaccination is by giving them names that are very easy to pronounce or names that people can relate to. You know, of the three, the Spikevax is that's a nice name that's very easy to pronounce. It's very easy to relate to, understand what it's about. It's just too bad that the Pfizer one is just a name that's a little bit harder to kind of pronounce or understand why they called it that. So it's definitely generally a good idea.
Comirnaty. I mean, we're just going to keep saying the Pfizer one like you just did. Raywat, final thought on these names?
Well, the good news is that it signals that the vaccines have been approved. Approved therapeutics tend to get marketing names like this. The bad news is that they're awkward. And also, what do you do for mixed doses? Are you getting Comivax, which sounds horrible? Right? So we haven't thought through all the various applications of these names. I don't think it matters that much. I think most people will keep on calling them Pfizer, Moderna, and AstraZeneca.
Yeah. We will too.
News anchors as well. For our sake. All right, Raywat, Deonandan, Colin Furness, and Dr. ALON Vaisman, thanks so much for being here on CP24 tonight.
Thank you.
Pleasure. Thanks.
Thanks.